Hello, this is DR.Khirod Chandra Panda back again to talk about topics related to otolaryngology and audiology. In this video, I am talking about tinnitus. The tinnitus odyssey, that's what I call it. I embarked on an odyssey as do so many others who truly suffer from tinnitus. I consulted many doctors but was in vain. Then I myself hammered the first nail into my coffin of sorrow when I discovered that it was somatic tinnitus. Yes, it was somatic tinnitus. I remember breaking down in tears in my wife's arms as to what had happened to me. I underwent CT scan test and MRI test. Surprisingly, the CT scan test results were all normal. However, the MRI test result revealed that I had mild cervical spondylitis, but the pain was not bothering me at all. What was bothering me was that the total loss of silence. With this introduction, let us discuss about tinnitus in detail. Primarily, tinnitus could be categorized into three types: objective tinnitus, subjective tinnitus, and auditory hallucinations. Objective tinnitus is pretty rare, and the cause of objective tinnitus could be sound in the body. The sound could be turbulent flow of blood or muscle contractions in the head. And the objective tinnitus could be heard by an observer. On the contrary, subjective tinnitus is the most prevalent type of tinnitus, and it has got many forms. It can be a benign form wherein the sound occurs only occasionally, or it could be severe devastating roars occurring 24/7 and affecting the total quality of life. The causes of subjective tinnitus could be noise exposure, ototoxicity, or Meniere's disease. The primary objective of finding out the causes of tinnitus is to find out the anatomic location and the abnormalities, the properties of the abnormalities, and how these abnormalities have led to the occurrence of these sounds. The main causes could be auditory causes or somatic causes. As I described to you earlier, the auditory causes could be ototoxicity, noise exposure, or Meniere's disease. The non-auditory causes, there are somatic causes. The main causes are temporomandibular joint disorders and cervical spondylitis. In temporomandibular joint disorder, now this joint connects the lower jaw to the skull. Any abnormality or disorder of this joint would lead to pain in the facial area, lower jaw, head, neck, and it would also affect the normal process of biting and chewing, the mastication process. Now, the main cause of temporomandibular joint disorder is bruxism, where there is jaw clenching and teeth grinding. Now, this jaw clenching and teeth grinding will lead to dislocation of the disc in the joint, and at the same time there will be abnormalities in the muscular functions of biting and chewing, and these abnormalities would lead to muscle spasm, thereby causing tinnitus. And the treatment could be braces, dental braces, or other dental work, or bite splint. Now, research pertaining to temporomandibular joint disorders and tinnitus have revealed that even a simple bite splint would reduce the somatic tinnitus due to temporomandibular joint disorders to a substantial extent. Now, the most worrying factor is that most of the doctors are unaware of this, that temporomandibular joint could cause tinnitus. And cervical spondylitis, as you all know, This occurs due to the degeneration of the soft disc between the body brace and it causes nerve compression. Due to this nerve compression and muscular spasm, one would also experience tinnitus. My whole point in this presentation is that once you come across this, the problem is somatic tinnitus is underdiagnosed, and in most cases it is misdiagnosed. How to diagnose a case with somatic tinnitus? There are two parameters in tinnitus. One is the pitch and the second is the loudness. Ask the patient to do neck maneuvers and muscle pressing in the sub-occipital region of the head. Ask the patient to do the eye movements also. And if there is changes in the pitch and loudness of the tinnitus, and I reiterate, if there is change in the pitch and loudness of the tinnitus, then probably it is somatic tinnitus. Then refer the case to the appropriate specialist. In case of cervical spondylitis, you can refer the case to an orthopedic specialist, or in cases with temporomandibular joint disorder, and if the patient is complaining of tinnitus, then in that case there could be a team approach in rehabilitating the case with temporomandibular joint disorders. In this, the orthopedic specialist is involved, dental surgeon could be involved, ENT specialist could be involved, and lastly, physiotherapist can also play a paramount role in alleviating the tinnitus caused due to temporomandibular joint disorder. Now, the most acceptable pathophysiology of auditory tinnitus is decoupling of the stereocilia from the tectorial membrane. There is alteration in the stereocilia. This alteration in the stereocilia causes decoupling from the tectorial membrane, and due to this decoupling, there is increase in the neural firings. Due to the increase in the neural firings, a person experiences that as tinnitus. My only concern is that I do see cases wherein the somatic tinnitus is underdiagnosed. Even tinnitus due to auditory causes are underdiagnosed and misdiagnosed. Therefore, I hope this video will create awareness among the medical professionals as to rehabilitate the cases with tinnitus in an effective way. Hope this video will be liked by you all. Thank you and good on you.